Like many of you, I'm trying to change the world, or at least one little tiny part of the world that I know would have tremendous benefits to almost every single person in this room. My journey has been shaped by passion and purpose, but has been influenced by factors well out of my control, taking me in a direction that I had never planned, and feeling at times like Alice going down the rabbit hole. It started with my mother plopping a violin in my hands when I was 4 years old. My mother was the original Tiger Mom. And as such, I grew up never feeling quite good enough, cursed with the need for perfection and overachievement. Now, I admit that some of that nature was genetic, as I'm known to organize crowns by size and color. But because of her persistence and this tiny violin that looked like a Christmas ornament, I soon developed a passion for music, began practicing really hard, and decided to pursue a career as a violinist. But becoming a violinist required hours of practice, and I was practicing over 4 to 8 hours a day through college. And this ended up in a hand injury that required surgery at the end of my 3rd year of college, forcing me to reconsider my life's plan. Fortunately, it was a blessing I had not put all my eggs in one basket, and I had studied biology along with music. And so I decided to change course, or more like a hairpin turn, and become a hand surgeon for performing artists like those who had operated on me. And then, during my medical training, more of my family members underwent treatment and surgery for breast cancer. In fact, every single woman in my family, going back 3 generations, has had breast cancer. I met with a genetics counselor at UC San Francisco who told me that I had an 85% lifetime risk of developing breast cancer myself. What do you do with that information? You learn everything you possibly can about it. So once again, my journey shifted, and I chose to specialize in breast cancer diagnosis and become a breast imaging radiologist. I knew the struggles that my family had faced, and I wanted to make those experiences easier for women. The mammogram was more than a picture to me. It was a mom, a grandmother, a caregiver, and the patient I would see would be holding her breath until I told her that everything was okay, or at times held her hand and explained how I would try to help her get through this road. It was difficult not to internalize the patient's anxiety and fear, and I had failed to create a good life balance for myself. My 2 young sons mostly saw me after very long, grueling, and emotionally draining work days, and I would sadly be looking at my watch wondering, when are they going to bed? So I could wake up and do it all over again the next day. Well, then I had a wake-up call. In my mid-40s, my own high-risk screening MRI appeared to show the signs of early bilateral breast cancer in me. So it was finally my turn. Like many of my patients, I had to step back and analyze what was most important in my life. That was easy. It was my young sons, my husband, my family. And so I chose to do the downgrade, followed by the upgrade. And I chose to retire. Well, for those of you who know me and my posse of girlfriends out there who took bets, retirement lasted 2 months. I was still passionate about helping women beat and defeat breast cancer. And I knew, with all my years of experience, that we could significantly improve breast cancer screening and detection just by improving patients' access to prior mammograms for comparison. You see, the problem is this, and most patients don't know this, but their doctors typically don't know this. There is no normal mammogram appearance. The breast tissue, being on the outside of our bodies, is as different from one another as our faces are. So, as you're trying to label yourself, realize that you go through many of these appearances during the course of your life. But it's amongst these many uniquely different appearances that we are trying as radiologists to determine what is normal versus an early sign of breast cancer. When we have a comparison mammogram available to assess for interval changes, we can detect breast cancer 25% earlier. This is huge. And not only that, when we have that comparison mammogram, we reduce those false positives, you know, the dreaded callback, by 60%. Okay, let's do a quick poll. How many of you have had a mammogram? Well, that's a lot. And how many of you have had to change where you go to get your next mammogram? Approximately 1 in 3 women do not have a prior mammogram available when they go to their exam. And this results in significant additional unnecessary imaging, anxiety, radiation exposure, and costs. So, with the help of people who have expertise in technology, cloud computing, business, and public health, we founded a nonprofit technology company, Mammosphere. Mammosphere electronically stores and exchanges mammograms and other breast exams in the cloud so that you have your pictures available for comparison wherever you go. Certainly, you might move for your job or your family, or be told to go to a different imaging center because of your doctor or your insurance. Mammosphere is helping women. And what we are doing is trying to improve how healthcare is done by reducing the inefficiencies and the healthcare costs and improving patient care. This is a disruptive technology. Today, if you go to a breast center with a new breast center, the first question you are asked is, where was your prior mammogram performed? Whereupon they attempt to find that facility. That is, if you even remember where it was done. And they fax a form. The form sits on a machine until a person has time enough to pull up those pictures on a computer, burn a disk, and send that disk in the mail. The radiologist is waiting for the disk to arrive and get loaded in a computer so they can do a side-by-side comparison. Meanwhile, you're anxiously awaiting your results, probably 2 to 3 weeks, and likely losing sleep. And if you do have a problem and you do not have the time to wait for that prior study to arrive, or it never does arrive, you are more than 2.5 times as likely to undergo additional unnecessary imaging and possible needle biopsies. Now, meanwhile, your girlfriends are watching you go through this and suffer, and then they decide they don't even want to get a mammogram. Well, here's the good news. Mammosphere is markedly improving this process, and we are exchanging studies so that you can have these studies immediately available for a more immediate diagnosis and a more accurate diagnosis. We are installing this technology through hospitals and imaging centers throughout the country, forming a network between all breast centers that is absolutely going to help patient care and reduce costs. Here in Northeast Florida, we are at Precision Imaging Centers, University of Florida, soon St. Vincent's Healthcare, and many others. Our latest achievement is we are now at the renowned University of California, San Francisco, and building a network in the Bay Area. Many of us have iCloud accounts storing our family photos, and yet you can store your photos that will make the most difference in your life and possibly save your life. Women can go to our website and they can upload, store, and exchange their imaging studies so they can have those available to their physician wherever they go. Additionally, think of the incredible impact we could have if we all stored our mammograms in one repository, where we could take millions of mammograms and feed them through a Watson computer and analyze the earliest sign of curable breast cancer. We are providing this service through grants from Riverside Hospital Foundation, Florida Blue Foundation, Susan Teller, thank you, and many donors. We have the support of the State Surgeon General, the head of public health, and the entire congressional delegation for Northeast Florida. There is no downside to this technology, and Really, it seems like a no-brainer, but because it's different than what is being done, this is taking time and social change for adoption. What are our barriers? Well, for one, hospitals want a universal IT solution to exchange all of their electronic medical records and images. But this is not going to happen when there are over 320 for-profit companies that each have their own technology, that are exchanging and not even talking to each other. As a nonprofit, we are trying to connect all breast centers, keeping the patient in the forefront of our minds, not the investor. A second barrier is that patients want their doctor to keep track of all their records. You really cannot rely on your physician to track down your prior studies. Really, it is easier for them to just order more tests and do a biopsy. So one of my calls to action is for you to take control of the future of your health care. You can and should keep all of your images in one spot, just like you take the time to store your family photos in an album. By providing your physician with all of your prior studies, you are improving your chances, or I should say your chances for early detection and reducing your risks for false positives. The third barrier is security, particularly with numerous security breaches in the media. Not only do we encrypt our data, but all we are storing is the picture with the name and birth date, but no other personal or medical health data. We need this technology now. And I'm hoping with your advice, your support, like us on Facebook, ask for us at a breast center that you go to, and your connections, that we can together move the needle on women's health. So let me pull this back to my journey and what have I learned so far. Finding your own individual passion and purpose may take time, shaped by experiences that you cannot control. And as you come upon roadblocks, which you will, use those as opportunities to reassess, grow, and possibly change course with your journey. For those of us that are struggling to find our highest purpose now, there is a recipe according to Marcia Wider. Close your eyes, think of 3 moments in your life when you were passionate about something, and then look for the common threads between those moments. Another lesson that I'm still learning is that waking up each day to try to improve the world is good, but finding a balanced life is important, and enjoy a bit of each day too. I have to constantly remind myself of the Serenity Prayer because I certainly have not found the right balance yet. The third lesson, as cliche as it sounds, is surround yourself with others who support your passion and your purpose. You need energizing support for your efforts, your mission, and your meaningful life. And then lastly, how you pursue your purpose is even more important than what your purpose is. My girlfriends and I have simplified these recommendations. Call it a prescription. The C's to avoid during your journey are control, compare, and complain. Your journey may be largely out of your control, and you're just going to have to go with it. Comparing your course to others just distracts you from your purpose and your value, and complaining is counterproductive. The C's to seek: connect and communicate, counsel and conscious gratitude. You need to surround yourself with positive people. You need to seek the advice of a good mentor, and then be a mentor. And then lastly, happiness is a conscious choice, and it has more to do with your attitude than your circumstances. So, in conclusion, by attending this Gen W conference today, you are surrounding yourself with women and a few men who are supporting your mission, your fight, and your dreams. By ourselves, we can make a difference, but together, we can change the world. Thank you.